The challenges of accessing dental care without insurance. I'm Jill Horner. This is Comcast Newsmakers. With me is Rick James. He's Vice President of the Board of Directors for HealthLink Dental Clinic. Thanks so much for being with us.
Thanks, Jill. Thanks for having us.
Many people who are working, who may have access to health insurance, don't necessarily have dental coverage. That's where you as an organization work to step in.
Exactly, and it's primarily for those people that are making less than 250% of poverty level, so it's low-income earners within Bucks and Montgomery County.
These are individuals, families who are working families. What does it mean to have a program like this in place where they can access dental care? What does that mean for them, not only financially, but for their overall health?
Well, financially it's great because we don't charge our patients anything for the services that we provide. It's all through volunteer dentists and a couple of paid part-time dentists. But the important thing for the individual is that it is important for their overall health. We have had several instances where we've detected things with individuals that we were able to get corrected before they became larger problems, an oral cancer, for example. So having that type of free dental care also impacts their overall health.
That's an important point. You are working to grow the programs that you have available through a partnership with Temple University.
Yes, we used to provide just your basic cleanings, fillings, extractions, and x-rays, but we've now got a program with Temple Dental School where their students needed additional practical hours doing root canals and crowns, and we weren't providing those services. So we now have students coming in once a week. They're doing those root canals and crowns under the guidance of a professor. They're getting the experience, and we're getting that as an additional service that we're able to provide for folks now.
You mentioned this is a service primarily for low-income working individuals, but you've also expanded eligibility for those who are veterans.
Right. Our founder in 2001 wanted this to be a hand up, not a handout. So there was an eligibility requirement that people be working, but below those poverty level guidelines that I mentioned. A couple years ago, though, we changed that for veterans. So we're now providing free services to veterans, even if they're not working, as long as they're in the household where they're still less than 250% of the poverty level.
Talk to us, though, about how people can work to make a difference with your organization. You do rely on volunteers.
We do rely on volunteers. We have 13 volunteer dentists and 2 part-time paid dentists. We do refer out to some oral surgeons for work. But the biggest thing we need support with is financial support. We're a low-budget operation, $450,000 of costs to run our clinic last year. But in that same time, we delivered over $800,000 of free dental services. So for $1 of operating costs, we're delivering $1.7980 worth of free dental services.
And people can reach out through your website for more information about getting involved, making a difference for HealthLink Dental Clinic, or finding out more information about eligibility.
Exactly. It's all right there on the website.
Thanks for being with us.
Thank you.
We've been talking with Rick James. I'm Jill Horner.